Really, breast revision is really kind of any breast procedure that's performed after an initial, usually augmentation with a breast implant. So some of the things that can occur are whether it be a breast implant is placed, maybe later the breast implant needs to be exchanged and a breast lift also done at that time. Sometimes patients can have some excess breast tissue kind of hanging off the implant. That's something that we refer to as a Snoopy deformity. The word deformity sounds terrible, but all it means is the breast tissue is kind of hanging off the implant. So a lot of times to kind of tighten that skin and potentially exchanging the implant can be really beneficial. Patients can have kind of malposition of the implants where they can kind of like either drift too far laterally. Sometimes in those cases, placing stitches or potentially even an internal mesh or a sling on the inside, kind of where the implant is under the skin, can help to position them back more toward the midline. There are sometimes that patients can get a pretty, hopefully rare complication called capsular contracture, which is an abnormal scarring around the implant. Sometimes that can be treated with just kind of what we call scoring the capsule, or what's called a capsulotomy in plastic surgery world. And kind of scoring that can actually help to kind of open it up and have the implant sit more kind of natural or in a softer kind of look and feel. And then sometimes the actual capsule needs to be removed entirely. That's a capsulectomy. Pretty rare, but certainly when you do a lot of breast surgery, I can do a lot of breast surgery. If you do a lot of breast surgery, you tend to get a lot of patients who are interested in revision breast surgery because the complexity certainly can increase kind of more issues the patient has. As far as revision in regards to a breast reduction, I have done second breast reductions on patients. None actually that I've actually done the initial reduction on. I actually had one patient who I did her third breast reduction that she'd ever had in her life. Some patients, due to hormonal changes in the body, the breast tissue gets quite stimulated and grows, and that's what was the case in this particular patient. But to have to revise a breast reduction usually would just be kind of small tweaks, kind of removing a little extra skin or things like that after a breast reduction. But to have to do an entire breast reduction a second time is pretty rare. When it comes to revising a breast lift or mastopexy procedure, if anything would actually be necessary in that regard, it probably would just be wedging out a little bit more skin later on. I mean, the skin is always being acted on specifically by gravity, and over time, 10 years, 15 years longer, who knows, sometimes the skin can get a little bit more stretched, and to have to revise and remove a little bit more skin just to kind of tighten things up, I would say probably not a never event.